All right, salam everybody. Thank you for your patience while we got started. Welcome to another segment of the Samovar Network. For anybody who is watching for the first time, we are a group of community members with different roles, experiences, and we gather once a month to discuss a topic that's relevant to the Afghan diaspora. We're very, very excited this month to create a space and an avenue for discussion on a topic that's very important, and that is mental health. And mental well-being as well, and how that relates to the Afghan community, to the Afghan diaspora. It's definitely a topic that's incredibly important, and we have a group of wonderful panelists who have a range of experiences in mental health, to be able to kind of engage in this discourse with us today. For anybody who, is watching maybe somewhere for the first time, my name is Afifa Zaman. I'm based in San Diego, California. I'm a community college counselor and instructor, and I'm also working on getting my license as a clinical counselor, professional clinical counselor. It would be great to have the rest of our panel introduce themselves as well. And I'm hoping maybe we can start on my far left, which is Ali. So maybe if you want to go ahead and unmute yourself. And
Greetings, my name's Ali. I live in Berkeley. I study Chinese medicine and practice at a student-run clinic in Oakland, California. We have a reduced clinic, so we get quite a range of patients. And personally for me, mental health is something that is absolutely revolutionary, that to actually engage in destroying the systems that oppress us, we need to be ready mentally, physically, spiritually to pursue that quest. And so that was part of my joining in studying Chinese medicine. And on the other hand, I felt like I wanted to regain some of the roots that were lost through the displacement that my family went through. I come from a family that practiced traditional medicine for many generations, and that was lost along the way, and I'm hoping that I can begin to reclaim that.
Wonderful, thank you so much. Mariam John, you want to go ahead? If you could just go ahead and unmute yourself. There you go.
Hello, can you guys hear me? Are you guys able to hear me? Oh, okay. All right, so my name is Miriam Rasuli. I'm a licensed marriage and family therapist, and I am really passionate about mental health. My first interaction really with wanting to do anything in this field was an internship I had actually in college, and I actually dealt with sexual abuse. It was my exposure, and it was just like a big shock because of like the sheltered environment that I was brought up into. So that kind of just led me to like I want to do something, whatever I can, and for me therapy, assisting in that way was the best mode for me, and I've been doing it ever since. So thank you guys for having me here.
Thank you for being here. Dr. Alami, do you want to go ahead?
Yes, thank you, Afifa John. My name is Kai Salemi. I actually am an assistant professor of research methods at Loma Linda University, and a large bulk of my work, aside from teaching, is doing research on refugees. And I've recently conducted, a few studies on Afghan refugees down in the San Diego area, and just recently in Turkey as well, where you have a mass influx of Afghan migrants, predominantly young men who are flowing into places like Turkey and the European Union. So it was amazing to see firsthand all the things that our fellow countrymen are going through in the diaspora. And I thank you, Afifa, for putting this together, and I look forward to a lively and rich discussion here. Thank you for having me. Yeah.
Thank you for being here.
Sure.
Sawajan, do you want to go ahead and introduce yourself as well?
Hi, I'm Sabah Mohid. I am from Ohio, but I currently am based out of the Bay Area, California, and I focus on criminal defense work and civil rights work. I went to law school, and so oftentimes the work that I do and the clients that I deal with, a lot of their struggles aren't just legal issues, but there is an intersection with the mental health aspect as well. So. And I'm also an organizer for the Samoa Network, and I'm happy to be part of this discussion.
All right. Last but not least, Sai, you want to go ahead and introduce yourself?
Hi, I'm Dr. Zaid Baha. I'm a West University of Health Sciences graduate in California. I graduated this year, 2016, and I'm starting my residency in psychiatry at Michigan State University. So I'm living in Detroit now and loving it, all the rain that's here. I have interest in refugee medicine, and I'm gonna, as of right now, I want to pursue addiction medicine and or psychosomatic medicine. And so, yeah, and again, I'm really happy that Afifa John set this all up for us to have a panel to discuss about mental health.
Yeah, wonderful. I'm getting all the credit, but it wasn't just me. Really, it's a group of organizers for the Samovar Network. I'll take some of the credit. Just kidding. Kind of as you can see, we all have this wealth of knowledge, wealth of ranges in terms of, our applied work with mental health and the way that it intersects with some of our other roles and responsibilities and career paths as well. And one of the things that I'm hoping that we can address is kind of as we're talking about mental health in the Afghan community, how does mental health, how is it viewed in the community? How does the community navigate issues of mental health based on, your range of experiences?
Could you actually repeat the question? It was cutting out just a little bit.
Sure, I'm sorry about that. So the question is kind of, based on your experiences and based on your perspectives, how is mental health viewed in the Afghan community? How do we navigate issues of mental health, challenges with mental health? Pretty much what's our stance? Do we even see mental health as part of overall health?
When I look at that question, I try to look at what like the World Trade Organization and other really big mental health organizations might define mental wellness or mental health, mental well-being. And WTO actually defines it as mental health as a state of well-being in which every individual realizes his or own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. And the state of mental health well-being for the Afghan community is poorly described, poorly defined due to scarce data, excluding Dr. Alami's great work that he's done recently on the subject. Again, we're also like a very diverse population. We come from different socioeconomic backgrounds from Afghanistan. We have different stories to tell as to how our families arrived here. We presently live in a different socioeconomic conditions now than our families did 30, 40 years ago, and because of that, it's really hard to really pinpoint where the mental health and well-being of our community is in Afghanistan. It's just really hard to describe, at least for me.
If I can interject here. If you were to define what mental health is for Afghans, I think the question is very difficult, because I believe this whole concept of stress or distress is something that's possibly a new phenomenon among Afghans in the diaspora, and it's a well-known phenomenon. Everyone knows it occurs. But I think the definitions of what distress is, or what the causes of stress are, what the symptoms, and what the potential treatments are, vary according to who you are, and it really is explained by gender. It varies according to gender, according to levels of education, and also religious beliefs, and a range of factors. So I can tell you, based on my experience doing research with the Afghan community down in San Diego, if you ask these individuals what psychological distresses or what depression is, based on my interviews with people, what you essentially get is that people view disorders such as depression or just distress in general as something that's socio-somatic, in a sense that it's social flux that causes symptoms in the body, really. And so mental health is really situational in a sense, and most people won't say that it comes from chemical imbalances or it's hereditary, or it's your genes, it's in your genes, in your DNA, right? But people generally, I believe, think that distress or mental health, or what would be conducive to mental health would be not having various situational stressors, which can range from cultural adjustment factors, to socioeconomic factors such as being unemployed and loss of social status and whatnot. But the research that we did is really preliminary. So I mean, I think further research needs to be done to really get at the definition of what mental health really is, or what it means for the Afghan community.
Yeah,
Thank
thank
you.
you, Dr. Alami. Thank you. I mean, I think one of my takeaways from this is that, the Afghan community certainly is not homogenous, right? That we vary, our experiences vary, and I think that's one of the things that both of you touched on. And also that our ideas about mental health are certainly not homogenous as well, but there are some commonalities in terms of our experiences and how we perceive mental health. And I know that one of the things that you mentioned was, the manifestation of like somatic symptoms, right? So even, it doesn't always align in terms of how we've been taught to think about mental health per se, always in American culture and American society, that it does look differently sometimes in our community. And so I appreciate you bringing that up, and hopefully something that we can kind of come back to. I'm not sure if anybody else had a particular comment about that question, but I'm sure if you do, you can kind of incorporate it into, a next piece as well. One of the things that I'm wondering is, what are some of the challenges that you see our community struggling with? What challenges with mental health do we have? What things do we see arising or coming up? And I know, based on your different lines of work, that we see them in different ways, right? And I mean, look at just the wealth of the diversity in this panel in terms of ways to address mental health and, methods of healing. And I don't know if Mariam John, I can ask, maybe to start with you in terms of what are some of the challenges that our community faces in regards to mental health and well-being? Sorry, you're going to want to unmute yourself again.
Hello? Okay, sorry about that. I keep forgetting. Well, based on my clinical experience, it does differ based on gender, based on based on acculturation, based on the amount of, if they're born or if they're first, second, third generation Afghans. I mean, the most common right now is PTSD from the clients that I've been working with, as the new kind of influx of Afghans are coming in, whether it's through the translation, what's it called, translators that are coming, or if it's political asylum, or if it's if they're even families are being sponsored, for example. I mean, that's still occurring. Or, for example, people getting married and their spouses are coming. I mean, that stuff is still happening. So I'm seeing a lot of the PTSD. I'm seeing a lot of depression. I'm seeing a lot of anxiety, trauma-related. Also, substance use. It's co-occurring with the depression, anxiety. It is something that Afghans are using to, help them get adjusted, help with the acculturation, the separation of families. So, and then obviously our generation or younger generations, it's the generational gap, the identity issue, crisis, things like that, from my experience.
So I would say, like, in the line of work that I do, with specifically with criminal defense work, oftentimes what I see is my clients, they struggle with depression, bipolar disorder, schizophrenia, and oftentimes a common theme amongst my clients once it gets to the criminal level is that, you know, they aren't getting the treatment, or they're not getting the support that they need to address those issues, or whether that's in the house or whether that's like them actually taking a step on their own to address the issue. I'm going to take it a step further. I think that there's another one that we don't speak about enough in our community, and it's kind of like, I don't even know if it's ever been addressed, but it's body image issues. I think it's really common, right? Especially amongst the, and I would say that it's gendered, right? I would say that the women in Afghan community deal with body image issues, and Eurocentric standards of beauty kind of, you know, add to that, right? So, you know, there's like common phrases like, you know, alif bori adam bashe ya kamar barik bashe, right? And for girls to live up to these standards, and then they end up dealing with and struggling with, you know, different types of eating disorders or accepting themselves, and that, you know, I noticed that one thing can trigger and lead to other struggles. So I think that there's a couple different things, right? There's the actual mental health issue, right? But then there's also the struggle with finding acceptance within the community, finding acceptance starting within your household, and even I think individually, like understanding and recognizing and being self-aware that this is something that, you know, someone might be struggling with, whether, you know, whether I might have to accept that I'm struggling with depression and or whatever it be, just as an example, right? So I think that that's kind of something that I see in the household. And OCD is actually another one, and so the other thing that I notice is that the language that we use when we communicate to people not necessarily that we use to communicate to people who struggle with mental health issues, but that like we use words loosely, right? In our everyday language, like, oh, like dewanasti, you know, like you're crazy, or oh, I'm being really OCD about this, or, you know, these words actually have meaning to someone who really does like struggle with it, you know. And so I think that there's a tendency to be careless with our use of these words as well.
Thank you, Sabajan. I know Ali, maybe you wanted to go ahead. I noticed that you wanted to say something as well. Oh, you can unmute yourself.
I'm sorry, I didn't want to say anything, but I guess I could speak since I'm talking now. Something that was coming to mind as everyone's saying what they're saying is this underlying like hit on people's self-esteem. No matter who you are, being in the West, trying to live in a white society that's where you feel powerless, where, you know, the structure wasn't determined by you, where the image is something that you're not, and constantly you're fed an image that makes you think that either you're a terrorist, or you're a rich oil person, or you're a womanizer, or yeah, I mean, those are like 3 images that I know of myself based on TV. Everything hits on your self-esteem, and then from that perpetuates all sorts of anxiousness, you know, issues with self-image, substance abuse, and then on goes the cycle. It just like, that's what comes to mind as people are talking, and just in my own life, that's what I've noticed.
You know, I wanna add real quick, and I will get to the next question. But with Afghans in America, our diaspora, I do apologize if I offend anybody, but I don't see much of a difference between the challenges that other minorities and majorities face in America versus what Afghans in this country face. I think women who have body image issues in our community, Americans, white people, Hispanics, Black people, they also have same or similar body image issues, and even to the what is, I think, women predominantly have more body image issues than men in general, and it could, it's like a risk factor. It could lead to some sort of anxiety disorder, and even amongst other populations, majority populations, women have a tendency to be diagnosed with anxiety disorders, 2 to 1 versus men, I think you see that same proportion, possibly. I don't know. I'm kind of saying off the top of my head, but possibly see that same proportion, and possibly even greater amongst females in our community relative to other communities.
Certainly, and I think that you highlight a really important point, which is that these issues happen in our community, right? Abuse, domestic violence, eating disorders, body image, substance use, substance abuse, right? Those things happen in our community. Mental disorders happen in our community, but I think that the challenge is that they often go unaddressed, or they're not paid enough attention, right? Or they're very privatized. This is a family issue, right? Sexual orientation, right? Things like that sometimes our community doesn't even have words for, right? And so that's kind of a challenge, I think, that we navigate, that those issues are there, but then how do we give them voice? How do we address them, right? And also, what is unique to our community? And I think that there are a lot of things that are very unique to our community, right? I know one of the things, Dr. Alami, that your research continuously cites is that, Afghans are one of the #1 groups of refugees in the world for decades, right? That's pretty significant, and I think that one of the important things to highlight with that is just that refugee life cycle. And I think one of the things that I think of when I think about mental health in the Afghan community and challenges that we face are really things like generational trauma, right? As we come down into, a second and a third generation, and I'll speak for myself being here in the US, right? But that generational trauma, I think, is really something that impacts our community that really is not addressed. And generational trauma for me is really, this idea of like a ripple effect, right? Like, a traumatic experience, a migration, war, loss, all these kinds of things that, I'll say in my generation, my parents have gone through generationally, right? But, just kind of like when you drop a rock in a area, a bed of water, that the ripples continue out. And I think that's how I think about generational trauma, is that those things impact us. It impacts me, right? And I know that one of the comments that was posted on the Facebook page, kind of building up to the conversation, was, that people aren't seeing, somebody said, I'm not seeing this huge shift in, this generation, in the younger generation. They're still having mental health issues. It's still very hard to talk about, and I don't know why that is, and I think that generational trauma is a piece of that. I hope I did it justice, and, that's something that we could spend an hour of itself talking about, and I think that's going to be one of our challenges for this conversation, is that, we're simply not going to be able to do everything justice, but hoping at least to do something. And so that was just kind of one of the things that I wanted to share. So I know that there are things that our community individually is facing, in addition to the things, that other communities, other marginalized communities, are facing in terms of oppression and insidious trauma, this building of microaggressions and daily experiences, living in the US or in other places. So Bajan, go ahead. I don't want to keep talking.
Oh, no. I was gonna. Well, I mean, like you brought up some different words that I think might need to be explained as well, like things like microaggressions. What do you mean when you talk about microaggressions? But more broadly, I was gonna ask, because you brought up how this isn't just. It really isn't just unique to the Afghan community. This really does translate to other communities. And I was gonna ask, because I think you also do some work with. Do you feel like Western standards of addressing mental health issues and well-being apply to our community? Do you think it really works for our community? I know that you do some work that deals with that, so I was going to ask you if you might want to explain that a little bit and how you view that applying to the Afghan community.
Sure. I know that, Ali, I also really, really want to hear your perspective on this question in terms of does American mental health, the societal standards of mental health, the ideas that were raised, does that fit our community model? And that's a question that I absolutely love to discuss, and I would argue that in a lot of ways it does, and in a lot of ways it doesn't. I think that one of the experiences that I had was actually studying Latin American liberation psychology. And this idea of liberation psychology is really, looking at non-Western models of healing, of psychology, of mental health, and applying that towards an individual community and their needs. And, I think that a lot of my training in mental health, and a lot of the challenges that I have is, I often tell community members, people I know, family members, have you thought about therapy? Would you go to therapy? And they're the reaction is always generally the same, and I'm going to quote them. This is a direct quote. They said, "Ma deona nesum," I'm not crazy. Why would I go and sit in a room with somebody and tell them my problems and then pay them, And for me, that's just the reality of, okay, maybe we have to find a different way to make sure that our community's needs are being met, and one that looks familiar to them. And I think for me that really looks at and another example of that is just, like as we talk about somatic symptoms, right? Like in our community, a lot of times we'll describe things like as a sensation of the body, like jigaram khonasa, din dard mekuna. We use these sayings of, our livers and our hearts, and for me, a lot of people would say, okay, well, that's just, this manifestation of not really knowing what mental health is. But for me, that's like a wisdom of our community. That's a wisdom of our culture. And you look at a lot of like up and coming ideas in mental health, and they're all talking about like somatic experiencing therapy and using the body and healing, and we've been doing that for generations, and so for me, it's really about a process of reclaiming that and integrating that with what what we already know and what we already do, and really being able to create our own theories and create our own modalities for healing. So I hope I answered your question in a very
No, it was cool, and I'm curious to hear what Ali also has to say, because he has some experience using Chinese medicine as well, so I'm curious to hear your take on it.
Well, if we're talking about gardening, which I do a lot of, often when you're transplanting a plant, there are transplants that thrive really well. There are transplants that die. And then there are transplants that kind of like stunt. And one of the techniques you use is you take some of the soil with the original transplant and you use that in the actual hole that you make. And for me, that's such an analogy for kind of what we're talking about right now. And I think that assimilation, where you destroy all the things that you came with, will ultimately lead to its own psychoses and emotional issues. And if we're talking about PTSD as one of the root issues, and I personally think trauma and emotional pain is at the root of a lot of our issues, whether that's the people that get diagnosed or whether the people who are just walking around the streets like myself. If we're talking about those things, I don't think traditional mental health, the field, can really capture our issues. And I'm not convinced that pills will alleviate everyone's issues. It might numb us, but if at the root of my situation is emotional pain and trauma, numbing it doesn't really help. So therapy, I'm glad you brought that up. I think that is an alternate form that really would support resolving that. And Chinese medicine obviously has its own system, and I think that it is a valid form, just like Unani is a valid form, and just like modern Western psychiatry is a valid form. But we need to look at all of them as equals. Otherwise, we're just reinforcing Western supremacy. But I think it would resonate more to employ things that look familiar to us. I think that goes deeper. And in the same ways that I plant plants that are familiar to my ancestors, I think that employing, natural ingredients that my ancestors ate and used as medicine will go deeper in me.
Can you tell us a little bit more about Chinese medicine and how you see it differing a little bit from other forms of medicine in terms of healing?
I think the key difference is that it sees the body as a whole system, and so it doesn't see it almost as a hierarchy with the mind on top and everything else is inferior. And so we're not always treating the mind directly, and so people ask me, can you give me something that'll increase my serotonin? No, but I can treat your body so that we could get it back in harmony a little bit. And the other difference is that it works slowly. It doesn't want to really use the sledgehammer approach because then it perceives that as having side effects. And Chinese formulas are always a sort of kaleidoscope of ingredients that balance each other out. So it's very poetic in that way.
Very cool. I definitely have so many more questions, but I also know that, just for the sake of time, I'm hoping that, because we're addressing some larger themes, some larger ideas, and again, just for the sake of time, I don't know that we have enough time to kind of really do them justice, but I'm wondering if somebody would be able to define some of those terms for us. And I know one of those is trauma. trauma, somatic symptoms. Mariam John, I don't know if you'd be willing to maybe kind of jump in and tell us a little bit about what those things are.
Okay. Let's see. So the trauma or that was being discussed. So basically, it's an emotional response, right, to any kind of significant, terrible event, as many of you mentioned, war-related, natural disasters, any form of abuse, any kind of even political violence. In our case, there's been a lot of political violence, so you probably see that within the elders. So if you could think about it this way, like our minds are like factories, right? So we process these events. So normally, like a significant event happens, and it processes it in the brain, and it turns into a memory, right? However, when it's a significant trauma, it's just too large to even like process in your mind. So what happens is that it doesn't get processed. So it doesn't become an actual memory. So it remains more current, right? So this is when you see people that are more hypervigilant. They still feel like they're in, for example, the combat zone as the veterans that are coming in from different countries. So the nightmares, those kind of symptoms. So basically, these people are thinking like they're still in that mode, right? If it's been current or even if it's been years, people get triggered. Right, so the triggers can be anything that has to do with your five senses, right? Because when you're in a trauma-related event, your five senses are activated. So, like, if you smell something during that time, and let's say it's a person's cologne, right? And that person, whatever, they did some kind of abuse towards you, and you smell that cologne like 10 years later, you can potentially still get triggered. So that's just a little bit about the trauma-related. And going back to the somatic, it's basically your bodily sensations, as you mentioned, Afifa John. It's from my experience when Afghans describe, or even Middle Eastern, I mean, that region, those cultures, they describe their psychological issues through body sensations. So it could be tension, it could be shoulder tension, for example. It could be arms, hands hurt. It could be like chest pain, but it's actually related to their psychological issue that they're dealing with.
That's fascinating. So it's actually like physical pain experienced by the body, but it stems from like an actual psychological aspect. So like the phrase that Afifa John used, jigaram khunas, it actually kind of like ties in really nicely with that. I didn't know that at all. So thank you for explaining that, Mariam John.
Awesome. Yeah, thank you. One of the things too that I know Leo had mentioned was, medications and how we treat medications, and then also having this broad range of options in terms of our indigenous practices, our family practices, in terms of healing and the ways that, those have been taught to us, right? And I know Zaid, as a psychiatrist, that, that's part of what you do as well, or part of your role. And I'm wondering, your thoughts on medications in our community. I know that I've observed a lot of, the correlation in terms of treatment for mental health challenges or, other kinds of things. And I'm wondering what you think in terms of, is our community medicating correctly? Are we over-medicated, under-medicated? Like, what does that look like? What is the state of that in our community as well? I hope that question is clear.
No, yeah, it is clear. And I think with Afghans or just Middle Easterners or Central Asians or however way you want to define us in general, we have a lot of respect that we give towards certain authority figures, such as physicians, pharmacists, like you name it. And so because of this, we rely heavily on what our physicians tell us in our community when we do go to see a physician. I personally believe, like, unlike other minorities in America who are afraid of, people in white coats and whatnot because of past things that have happened in their communities, that makes them wary of wanting to get diagnosed by a physician or believe what it is that they're saying. With Afghans, I do believe that they rely a lot on their physicians, and because of that, I think that they do tend to get over medicated a lot. again, I don't see us being that much different than Americans in the way they look at physicians too, and pharmacists, and just the pharmaceutical industry. I think if we were able to set up some system, some way of being able to get people in our community that are unable to see psychiatrists or mental health professionals appropriately, or being able to see them, then they're gonna start to listen to other people in the community that might not have the right answers, and that kind of just will perpetuate the medications that they're getting from their physicians for other reasons that are manifestations of different psychiatric illnesses. I'm not sure if that really makes sense what I just said, but trying to rephrase it in a better way. But basically, we trust our doctors too much, and we need to be able to speak to therapists, other mental health professionals, so we can get prescribed the right medications, especially for people who are diagnosed with depression, but are showing signs that look like they're having anxiety, panic attacks. They've been prescribed benzodiazepines when they should be prescribed SSRIs, or just not prescribed anything. They just need someone to talk to. So basically, that's it.
Well, if I can chime in here real quick, I can tell you that I don't have direct clinical experience because that's not what I am. I'm not a clinician. I base a lot of what I say on my conversations with people, which I document in research studies and just drawing on research studies. What you generally get is that medications are, for the large part, not very helpful, and especially when Afghans and other refugee groups are, sort of obligated to visit these stigmatizing clinics, mental health clinics in particular. So what the research actually shows is that, for one, if you're going to deliver mental health services, it's best to do it through existing community support networks, such as mosques and community centers, and get religious figures involved and community leaders, trusted individuals who can, facilitate, therapy, which typically would require families to be involved in therapy, not individuals, because a lot of the problems that Afghans and other Muslim minority groups and refugee groups face are related to family stressors. Okay, and so, I could tell you, just talking to a lot of people down in San Diego and doing, a little bit research with them and looking at all the, published studies, is that, medicines only go so far, and they can be viewed as something possibly helpful in regaining functioning in extreme cases. But what about the people who deal with stressors on a daily basis, the daily stressors? These people who are not facing this extreme sort of stress, and they're not suicidal or whatever. But the thing is, I'm just going to finish here right now, is that we have to identify what those sources of resiliency are for these people, because a lot of people tell me that, instead of medicines, what we need is a community center where us old people can all hang out and talk politics and drink tea and whatnot. So I think identifying these sources of resilience, which really are rooted in our faith, our Islamic faith, and our families, I think that would probably be more effective than prescribing Western medicines, which really probably do more damage than good. Thank you.
Go ahead, Afif, again. Go ahead.
Okay, thank you. Yeah, one of the things that I'm glad that you bring that up, because it's important to look at the factors of resilience and what actually works in our community. And it sounds like you've had some firsthand feedback in terms of what our community, especially generationally, what people are saying they need or that they want, what's going to help them heal. And I really like that you point out that factor of the community and the family as a method of resilience, as a method of healing, because I think that disintegration of our communities, especially upon relocation and war, has really become a risk factor for mental health challenges, right? And that the reintegration of that is very healing to us, for the most part. But I also kind of want to challenge a little bit of the idea that you shared in terms of religion, I think, can be, very often a source of healing and a source of resilience. But I've also heard some, as with many things in our community, but it can also be kind of an added stressor sometimes. And I'm wondering kind of what the panel thinks about that. I often hear things like, if you have God or if you have faith, then you won't have mental health challenges, or, ideas like, you can pray it away, or, things like that are very common ideologies. And I think especially with a lot of the culturally held beliefs that we have in terms of, where mental health stems from. I hear a lot of correlations to like jinn and possession, and I've seen those things in my own family. And so that's kind of one of the things that I'm wondering is, how do we navigate both of those beliefs, or what do you all think in terms of your own experiences working with clients, working with the community? Is how do we navigate a healthy relationship between religion and mental health, if that makes sense?
So it's interesting that you asked that, because I wouldn't say, I won't say this for every Afghan, but religion tends to be a big factor in families' lives within the Afghan community. And so, and I feel like it really, really depends on the person and maybe their family background.
Yeah, I think she cut out a little bit, but I can add. I think I could add to that. I think I'm just an intern, so I've only seen probably a few hundred patients in the ward in a different in a different kind of environment, not outpatient, or not as many people outpatient as I would like at this point. But with regards to religion, and the majority of people that I work with who are patients who are religious, they're usually Christian, Catholic, or of the Jewish faith, and you want to use religion as a tool to help someone be able to better themselves. So if they are a religious person and they're not showing signs of religiosity, or their religion is kind of deteriorating them socially or occupationally, then you want to use religion as a means for them to be able to lift them out of their depression, get them to feel a little bit happier, get their mood lifted up a little bit. If there's a number of people that come through the door who say, I stopped going to church, and then I started feeling depressed for whatever reason. It's probably they're not depressed because they stopped going to church, but going to church helped alleviate some of the symptoms that they may have had with their depression. So it's in that moment that you want to take advantage of them, and give them a Bible, or if they're Muslim, you find a copy of the Quran, or whatever it is that you can get them to direct them to help them potentially get their mind off their depression for a little bit, and see if they can kind of grab onto a little ledge or a step to lift them out of their of whatever hopelessness or helplessness that they're feeling in the moment.
I'm not sure if anybody else has thoughts about this particular question. We can always come back to it. But I kind of agree. I think that religion can be a real factor of resilience and a tool for healing. But I also think, especially in my experience with liberation psychology in El Salvador, that, a lot of that is about, reclaiming some of that internal power instead of looking at it entirely from this, external locus of control. That, re-imbuing that internal power, I think, is where those two areas have real strength. So yeah, but feel free to chime in if you have other thoughts about that particular question.
I am. So my connection got lost, but I'm back now. So one of the things that I was going to say was, I think that there is, so spirituality is really, really important. It can be really, really important part of someone's individual life or someone's family life, and I think it's important to recognize that. I think there's another distinction here that I want to make, and that's that when it comes to mental health issues, I think that sometimes the people's approach to someone who might be struggling with mental health issues is that they might not really understand the severity of it, right? They might think, like, for example, if someone might be going through depression, right? The solution that someone else may try to offer, or a family or friend or loved one may try to offer, is, oh, hey, let's take you out for the day. Let's let's go to the mosque today. Let's try to get you to get back into religion. And that might be something you do, like, you know, let's go to the movies. That might be something that you do when someone is down, right? Or they're just having like kind of like a rough, they're going through like a little rough patch. But when someone's actually going through serious, you know, depression, that's not the approach that should be taken. And I raise that because it's something that I have seen quite often, right? There's people, loved ones that I have in my life that have gone through different mental health struggles. And so I kind of learned this and observed it over time, in that sometimes spirituality, although it can be really important, it can be healing, it has a tendency to also minimize the severity of what someone might be going through. And so that's kind of the point that I wanted to put out there, is that that this is something that does occur, and we should be mindful of serious, that they might need actual very serious attention. So yeah.
Thank you so much, John, for your perspective as well. I think that you brought up a really important point, and that was one of, you know, how do you express support, right? How do you offer support? How do we, as a community, you know, tackle challenges, or, you know, how do we care for others who might be struggling? And I think that, you know, on a personal note, that, you know, whether it's myself or, you know, people that I've known around me, I kind of feel like everyone has experienced some challenges, either, you know, themselves or with loved ones, in terms of mental health or mental wellness. And, you know, I definitely think that's one of the things that, you know, we want to address also, is how do we express support? And Ali, I don't know if your question or your comment is about this related, but if not, I do hope that we can come back to this point as well, but I do want to transition to you as well. Go ahead.
Yeah, I would like to add that to this question, actually. I think the ultimate goal for me would be for us to make people feel comfortable in whatever decision they make, and for them to be empowered in that process. So whether that means like not ridiculing people of decisions they make about their own treatments, or if it means like, you know, holding back and what we think is right for someone else. Ultimately, we don't know, and I mean, this kind of ties back to the last topic, for me at least personally in my life, where, you know, I started to question the existence of God at a really young age, and got pretty harsh pushback. I mean, I think that that's one of the most traumatic experiences of my life, when I was a kid, being surrounded by a bunch of older people pointing their finger and saying I'm wrong, and for eternity I'm wrong. But now, as I look back on it, I think it's absolutely important for us to make people feel comfortable in their pursuit for health and well-being.
Yeah, certainly.
I would be curious, has anyone here had, I know that most of the people here are professionals in the mental health field, but has anyone had any personal experience, whether it's like someone close to them, a friend, a relative, a loved one, that has experienced some type of mental health struggle, and what was that like? I'm asking anyone on the panel if they'd like to, you know, offer that. So I personally have experienced that, and I'd be happy to speak to that, but I'm kind of curious as to other people's experiences.
Well,
John?
yeah, so I personally believe that most people in this country or in this world suffer from mental illness to some, you know, degree of severity or whatnot, and so because of that, you know, I think everybody does need to speak to someone at some point, whether it's a mental health professional or whether it's a clergyman, or, you know, if you go to a mosque regularly, speaking to someone there, finding a loved one to talk to about, you know, your possible mental health issues, as long as they're not emergency issues, then I think people should, you know, kind of discuss those kind of things. I personally, you know, I have a sister who took her own life a couple years ago, so it's definitely something that I, you know, think about when I do meet patients who are, you know, have a similar presentation as to, you know, what kind of personality my sister had, you know, growing up with her and stuff. But yeah, you know, mental health. When she passed away, there are so many people that came to talk to me about suicide and depression. So many people I didn't know had relatives or friends who committed suicide, took their own lives, or attempted multiple times, or whatever issues that you hear about people having, and you don't hear about this stuff until it happens to you, and people come to talk to you, try to open up that dialogue. The best thing, though, with regards to the question that you asked previously about, I think it was like, how do we address mental health in our community? How do we talk to each other? And there's a term called affective empathy, and it's something that I think if we collectively as a community were able to like learn what affective empathy is, we'd be able to have this discussion or have these conversations more often with more like respect towards one another. Affective empathy, that it's defined as the ability to respond appropriately with an emotion to another person's mental state. So if you don't feel like you're equipped to be able to handle a very a crisis that someone is talking to you about, then it's important that you defer that to someone who could be better qualified, whether that's a mental health professional, whether that's a physician or a therapist, or just someone who you look up to, who you think could potentially help you. If they show any sort of affective empathy, which is intuitive in some people, I think you could further this, further the conversation along, especially if everybody in the community practiced it.
If I can just say something real quick. Dr. Baha, I thank you for sharing that very personal information with us. It takes a lot of courage to talk about these things. I appreciate that. I just like to, maybe play devil's advocate here in that, maybe the older generation, our parents and our, our aunts and uncles and whatnot, many of these people may think that the situations that they undergo on a daily basis are just a normal part of life and that it's God's will. So, I think this really makes it challenging in terms of getting, effective therapies to these individuals, or treating these people in one way or another. So, I can tell you that I have many aunts who are, a couple of them who are widows, who just, on a daily basis deal with this extreme level of gham, or sadness, right? And, it almost seems like it's just something that they've accepted, and that, and you see them praying, 5 times a day, and that's just, one way in which they cope. And of course they have their kids around them and whatnot, which helps as well. But I think the real challenge is that, we got to get people maybe out of this line of thinking that their situations are normal, because their situations could be better. We all know that. That's all I like to add.
Yeah, I agree with what you just said right there, and just to add to it a little bit, if you go to a funeral, an Afghan person's funeral, regardless of their age, it's a really sad event. It's very, very sad. Someone passed away, someone died, people are crying. But when you go to a non-Afghan's funeral, or a non-Middle Eastern, non-Muslim, whatever, you go to a white person's funeral or their memorial, it's not, you don't have that air of sadness as much that you would in an Afghan person's funeral or fatihah. People tend to try to celebrate someone's life after they've passed away, and you see a lot more people smiling and thinking about the good times, and whatever cliches you want to add to that. But when you go to an Afghan person's funeral, it's really sad. It's super, super sad. And then all of a sudden, then it just turns into a party. And a lot of times, and I don't want to go off tangent with this, but it's just like there's just this particular window of time when people are mourning, and the Quran Sharif is being read, recited, through a loudspeaker, and then once it's off, it's we're back to another mode. And I really wish that our community would be able to better mourn the death of people. I think that would trickle down towards how we could potentially handle people who have depression or at risk of harming themselves.
Yeah, thank you so much for your perspectives. I know I definitely agree in terms of, just acknowledging and recognizing that oftentimes our community grieves in different ways, and that even grieving can look different for us. And that in some ways grieving is almost more of a perpetual adopted state than it is a time frame, or it looks different, and in terms of, in my own practice, in my own learning, grieving go through the 5 stages, and you progress, and and it doesn't really look that way in our community. And I think that's important to recognize, that depression doesn't always look, the way in our community as it does in, a diagnostic book, right? That, all of these things I think really need to be molded and adopted to what our community needs. And I'm wondering, kind of as we're talking about this, right? We're talking about the need, we're talking about challenges, but what I'm wondering is also, how do we overcome some of these barriers? And I know that there are a lot of barriers to mental health in our community, or to accessing services. And, Mariam John, because of your, very direct experience with clients and kind of navigating that space, I'm wondering if you can speak a little bit about, those barriers. Well, what keeps people from getting that help, or reaching out for that help in whatever modality looks right for them? I hope that makes sense, as I always say. But
so the barriers, I mean, there are many, and a lot of you all have shared some of the barriers actually already. I mean, one of the main ones that I come across is just the lack of education of where to go, and kind of just the definitions of like what is counseling versus what does it mean to go to a psychiatrist, or social work, or case management. Some people just don't have their basic needs met, such as like housing and like food, and once they have that squared off, then they will be in a better mental state, so it's those kind of things. Also, I mean, you all have mentioned like the stigma and the cultural connotations of someone going to counseling and the community finding out, and a lot of people not wanting to air their dirty laundry. And I mean, one of the things I need to do, what I usually have to do when I talk to Afghans, is I have to really emphasize confidentiality and like legally what I can and cannot do, so they feel more comfortable. But it does take them a long time to kind of open up and trust, especially with the elder generations. But I mean, honestly, when I talk to Afghans, I just go off like self-disclosure, personal experiences, outcomes of the benefits, and we're a communal, more collectivist, society, right? I mean, or Afghan community. So families coming together, if that's what they want to do initially, then if that's what they're comfortable with. I think Dr. Alimi did mention that, majority, it's family systems issue. It's not just individual. So families coming together, I mean, you see that actually in doctors' offices too, in different cultures, like the Hispanic cultures. When I used to work in a doctor's office, like the whole families would come in for like a baby's visit. You know what I mean? So I think that's very similar to like Afghans too. They come together sometimes, even if it's like an older son. Like I've had clients where it's like older, an adult, but like his mom or dad, comes with him because they want to like be reassured like their son or daughter is fine. For example. So just some things like that I've experienced.
I have to say that us young people, in terms of the stressors that our older generations face, us young people could really serve as conduits in terms of, getting these people, the right therapies and treatments and whatnot. And but I don't mean to generalize, but the thing is that you have a high degree of intergenerational problems in our community, where, as you guys know, young people and the first generation that arrived here as refugees, they're very much distant from each other. That's actually what I found in our research that we did out in AAC in Berkeley, is that one of the biggest things that young people talk about in their interviews or in their surveys is that there's this sense of being, or a sense of disconnect between them and their parents, who really don't understand them. And it goes back and forth, in the sense that they don't understand their parents, their needs, and their parents really don't understand the type of things that they're going through in life and trying to negotiate. So yeah, I'm sorry for the crying baby in the background. You probably hear him, but yeah, he's been sick lately. I apologize.
It's very appropriate as we talk about generational challenges. So, and I know that actually, Ali, go ahead. I don't want to interrupt you again.
Sorry, so this makes me go back to the analogy I brought up earlier about the transplanting seedlings, and I think dually it is a responsibility of the place that we are forced to go to. In this case, the belly of the beast, the people who are partially involved for us to actually be here. I think they need to prep the soil. I think they're financially responsible for making us feel comfortable and making our communities have a sound transition, whether that means supporting the creation of community centers or making sure that we do have the opportunities to stay plugged in. And like I feel like we're also we should be granted ability to fly back. Like we are here because they forced a situation onto us. And obviously people sold out, Afghans did sell out, but the imperial power has some responsibility, and so does Russia as well. But something that I wanted to say from the previous question was somebody really dear to me described how mental health can be seen as a spectrum, and that some people who are diagnosed with an actual, let's say depression, right? They can present with symptoms at times and also present without symptoms at times. And then people who are not diagnosed or maybe don't warrant a diagnosis can also show symptoms at times and not show symptoms at times. And this made me really reevaluate everything. And so that was a helpful tool for me as we talk about the previous question. But one of the biggest challenges I find is that people can't actually fulfill treatment. We're living in one of the most difficult times financially in the United States. This is like the Great Depression era, and that's been my whole adult life. And so, like, usually with Chinese medicine, you need at least 10 treatments to kind of feel like, okay, this person's got it, and they can move on. And people just can't do that, and that's my reality.
Yeah, thank you for pointing that out, especially just the fact that, like I know Mariam John would agree that a lot of these things are very situational, but also, just this aspect of treatment and how people seek treatment, right? And I know that Dr. Alami, one of the things that your research highlights very much so is that, when someone's having a struggle or a challenge, because a lot of those symptoms are somatically based, right, they express in the body, that they often find themselves first at a doctor's office, right, as opposed to maybe somebody who would be more effective in terms of treatment, like a therapist, right? And research also shows that, in terms of healing, right, so not just treating symptoms, but in terms of healing, that the best combination for most people can be a mixture of medications and also therapeutic treatments, right? Because though you're treating symptoms, they're not learning new skills to cope, right? And I think that's kind of goes back to a lot of what you were saying, Ali John, about like, what kind of skills are we learning as a community to cope? What kind of skills are we teaching each other? And that goes back to my original question of, how do we address this as a community? How do we move forward? I know one of the questions that was posted on the Facebook page, let me do my best to get her question down, was, what can we do to bring awareness to this, and how do we as a community try to highlight PTSD as a real and valid issue? So kind of going back to some of the things that we were talking about, but how do we move forward? How do we, again, express that support and care and proper treatment for members of our community? But then also, how do we continue addressing this? How do we begin, approaching the topic with friends, families, loved ones, who we might say struggling? I mean, how do you address that?
So I heard this talk about a community center quite a few times come up. I have to tell you, I love it. My grandmother, she passed away a year ago, but she was actually part of a community center. It was an Iranian community center. And I can't tell you how much she enjoyed. Like, she would get so excited to go to this community center and just be around other people who she can relate with, and kind of have some sense of like support and community, people who can relate to her. And right, like, I'm not a professional in mental health, but there is a generational gap, and I think that there's also this difference between like our parents and our grandparents and our elders came from more communal, right, in their approach to things, and coming to America, things tend to be a little bit more individualistic in the West, and so it's kind of a difficult balance to strike when it comes to the elders in our community and supporting them and their needs. And so I love that idea of a community center. I'm not quite sure how that's going to start, but the other thing I was going to say is in terms of, I guess, being supportive and from my own experience, and this is things that I've seen, don't be arrogant, right, about people who are going through a struggle with their mental health. Be respectful and understand that maybe sometimes popping pills isn't going to solve their problem, and religion might also likewise not solve their problem. And they may have a level of self-awareness to understand their own triggers, and don't be too pushy and force people to do things that they know well, and be open to talking about it. I guess that requires vulnerability on all our parts, and just having like an open ear, right, to be there for our friends and our loved ones when they're going through something. Because these things, when it's not addressed, at the most basic level, these things can snowball into and lead to really, really tragic incidents. And at that point, you can't repair it, whether it's someone ending up in a really bad situation criminally, ending up behind bars, right, or it becoming deadly. So that's my piece.
I'm not sure. Can you guys hear me?
Yes,
okay.
we.
Yeah, thank you. I think because the extent of loss, or this concept of loss, is really so great within the first generation. Community center would be so practical in a sense that I think it gives people a sense of belonging that they don't have here in the United States, right? So let's not forget, though, I mean, there's a whole other generation here, this 1.5 generation, which is me, a person who grew up in this country, born in Afghanistan but grew up in this country. And then there's a lot of young people who are born in this country who face their own set of unique stressors. I mean, Dr. Baha earlier talked about, how, some of the prevalence rates are pretty much similar in terms of, in comparison, when comparing, Afghans with other minority groups in terms of anxiety and body image issues and whatnot. But I think our set of stressors that we face are highly unique, and, so I think, maybe, I suppose just wanted to bring up the fact that, there's this whole other group of individuals, population of individuals who are, who may face extreme stressors because of a whole set of unique types of stressors, like such as discrimination, racism, in which, living in a post 9/11 era in the United States, I mean, we've become more visible. Muslims have become more visible, so young people are definitely vulnerable, I think. So not to take the conversation in a different direction, but just something to think about maybe for a future conversation.
Yeah,
I know we're running out of time.
Yeah, certainly helpful information, though. Thank you.
Yeah, I have a friend who's Indian. He's Gujarati, and they have a nursing home for Gujarati people in New Jersey that he tells me that his grandparents love, because it's just a community just for them. And when they get to a certain age, they qualify for it, and they're in there, and they love it. Obviously they'd love to be with their children, in the house with them on the other side of the country, let's say, but they know that they have another community that they can kind of turn to if necessary. And unfortunately, with Afghans, we don't have that many Afghans in this country where we could potentially see a community kind of clinic of any sort just for Afghans. I see that as like wholly unattainable, just because of the cost of it and where would it be, and we're so far away. But You know, and 5 years ago, I don't think anybody even thought about telemedicine at all. And then now today, you have so many places, so many different states, counties in the country that use telepsych to talk to people, you know, in rural settings. I see that us using telemedicine, telepsych, telling anything basically as a means to get our community kind of closer to each other, even though we're physically so far away. And if we're able to do that, then I think there's a potential for us to be able to get someone like Mariam, for instance, who's a therapist, to be able to talk to Afghan families on the other side of the country that they're really comfortable with talking to about their problems, because appearance is a big thing, and you generally tend to, you know, divulge more information about your life if you're comfortable, and if that other person either looks like you, dresses like you, has the same mannerisms as you because you are a first or second generation Afghan-American or whatnot. And I think if we're able to use, you know, basically this form of communication right now that we're using to be able to talk to people around the country and create that sort of system, I think that would be something that we could definitely kind of try to push in the future.
Certainly. Thank you so much, Zaid, for sharing that as well. I did want to highlight that there actually are some community centers, particularly in the Bay Area. There's the Afghan Coalition, which has been doing advocacy work in the community in the Fremont area. They also have mental health services, domestic violence services. You know, they do all of these really wonderful, wonderful things, and they have for some time now. There's also the Afghan Mental Health Project, Khalil Center, which I believe takes on a spiritual and psychological approach as well. So there are services, and there are, you know, especially, I mean, in the Fremont Bay Area where there's such a high density of need and also community support, that it is possible. And I like the ingenuity of ideas, especially that you bring, Zaid, too. You know, one of the things that, you know, you highlighted, and as kind of we wrap up, you know, was just this point about, you know, having people that look like you, that understand your cultural values, that understand the backgrounds, that understand the struggles is so important. And I think that's where I would really want to take a moment just to emphasize, you know, like if you're watching this now live or later, we need you. You know, we need you in this field. We need your perspective. We need your experience. We need your passion. We need your understanding. And we need you and all of us to speak for ourselves. And I think that's one of the things that I appreciate about your research, Dr. Alami, is that you allow us, our community, to have our own voice. You know, especially in an area of academic research where, you know, I don't want somebody else talking about my community without really having a full understanding. And so, you know, unfortunately, you know, our time is up. As always, there's always more work to be done and more conversation to be had. Certainly, we've only grazed, you know, the surface of a lot of these topics, but, you know, hoping that perhaps we can come back to them again and again. But, you know, I did want to just kind of, as we wrap up, you know, thank you to all of the panelists for giving not only your time, but also your wisdom and experience and your knowledge, you know, as we give voice to this topic in our community as well. And for anybody watching, you know, thank you for your time. Thank you for your perspective, your comments, for the questions as well. You know, it takes courage to talk about mental health. It takes courage to address and to breach this topic. But I know that that's certainly not something that our community is lacking for. And so I think that, you know, hopefully this is just a start of, you know, amazing things to come. Thank you.
And I was gonna say, for those who are listening and those who are on the panel, if you guys know of any other resources that you think will be useful to our community, please feel free to post that on the Facebook page. It's live, and people will always be able to have access to that. So it is a resource in itself, and let's try to build off of that. So thank you to all for who are listening, and we hope you enjoyed this discussion.